Hi, welcome to the Dr. Second Chance channel. I'm Dr. Second Chance. Just in case you haven't heard of me before or my channel, I'm a licensed physician. I am a trained recovery and life coach, and I'm also a person with 13 and a half years of sobriety or 13 and a half years of what I call long-term recovery from alcohol use disorder and substance use disorder, which for me means I've not drank alcohol in 13 and a half years. I've not used any illegal street substance in 13 and a half years, and I've only used medications as prescribed by my doctor. Um, Recovery also for me means that I've taken the time to repair my relationship with my wife and my children, and that I've stopped committed crime, and I'm consider myself now a productive citizen, doing things like volunteering at different kinds of organizations. Um, I encourage you to always talk with your own healthcare provider. This presentation is not intended to be medical advice, but rather information for your own education, for you to think, ponder, think for yourself, and decide what to do with. The topic today is coffee, caffeine, and recovery. And this is a topic dear to my heart because for some reason amongst um, uh, institutions that are involved with recovery like detox and rehab centers, as well as in the addiction medical field, coffee and caffeine are a fairly universally attacked at best, um, given minor credit for positive benefits. And there are just too many phenomenal meta-analysis and um, studies, particularly at this last American College of Cardiology scientific update this year, that just shows the profound benefits of coffee and caffeine, and therefore really warrants some profound and direct thinking and discussion about this. And so let's start with just some personal views of recovery that I believe you can talk to your own doctor about it, but I believe they're very sound. One is that there are many pathways to recovery. As you may recall from the National Recovery Study, which came out in 2017, we found that basically half the people that recovered used something called an assisted pathway, and literally half the people that got into long-term recovery from alcohol or other drugs uh, didn't use any of the typical kinds of treatments, programs, or support that's commonly thought of for success and recovery. So like 46% said, yeah, I had a problem, but I don't now. 54% said, yeah, I had a problem. And of those, about a quarter went to professionals, inpatient, outpatient, rehab, detox, that sort of thing. 50% of those primarily recovered long term by going to AA and other support groups like that, Smart Recovery. About 20% went to some kinds of other support organizations like a sober living environment or faith-based support groups. And about 8% primarily said medication assisted therapy is what helped me get into long-term recovery. So the point is that there are many pathways to recovery, and that there's a large people that we really have no idea of how they recovered. And so that's important. There's lots of questions and unknowns about how to successfully get better. The second point that I like to make is that sometimes um, people that are clinicians or organizations like to harp, oh, we only follow the science, we only used evidence-based treatments. Well, that is really only partly true. People often do not do evidence-based treatments or science if they personally don't like it. And that's just a fact. And there's so many examples in medicine, I could go on for hours. But with respect to recovery, the most recent one is you can go online in a variety of places where you will see physicians that are in the drug treatment community saying that they absolutely hate and despise AA and that they would never send anybody there. And this is just all over the place. To say, oh, that's not so, is just to uh, not to deny reality. And so this would be one area of you can look at the Cochrane database recently, and that AA was clearly found to be as good, if not superior, to all sorts of commonly used interventions in rehab and outpatient treatment, cognitive behavioral therapy, individual counseling. This was a meta-analysis of a bunch of studies, and the evidence is overwhelming. And yet people will say, well, I don't want to count that evidence, even though it's pretty darn good evidence, because I personally don't like it. Or I had a patient with one or two bad experiences. And so my point is not to say AA is great. My point isn't to say that these doctors are bad doctors. My point is to say that um, you, as a person in recovery, it's up to you to sort through these issues, ask questions, do your own research, and think for yourself, because there's just a lot of ways that um, you may not find what you need. And as there are, I like to tell people, and as a recovery coach, I've helped lots of doctors and dentists and others recover, being a small part of the team. Um, and as a life coach, you need to be like Bruce Lee and Sherlock Holmes. Bruce Lee, the martial artist, as you know, said, research your experience, absorb what is useful, reject what is useless, and personalize the rest. And that is very much how successful recovery is. Um, the key is not uh, anyone telling you this is what you must do, although that may be a starting point. The key is to find out what works for you, and it's usually not binary. It's usually not, well, I go to AA or I go to Smart Recovery. Um, my experience, and this is just my opinion, I've known lots of successful people in long-term recovery that are living great lives, and they are hybrids. They pick and choose the best elements out of a lot of different approaches and utilize that in their life. That uh, so I'm not telling you what to do, but I am telling you how to do it, and that is um, ask questions, look around, find out what works well, and maybe give it a try. Which gets back to the whole coffee, caffeine, and recovery. Um, I enjoy a few cups of coffee a day. Pretty much everyone I know in long-term recovery has no problem with caffeine, but it might be a problem for a few people. But on a separate video, I will honestly try and present the data that addictionologists have with caffeine and caffeine use disorder and all these things. Um, so you can judge for yourself. And of course, Sherlock Holmes is a detective. And so you also want to, you know, truly research, think about things, look at the evidence, um, to, read. I'm a trained physician. I can read scientific literature, but you can too. I mean, it's not like you have to be, it can be a little more difficult. Sometimes some of the writing or the statistics is a little tough to interpret, but there's no reason you can't pull abstracts from all kinds of addiction research and at least read it, see what you think, ask your own physician or healthcare provider about it, or addictionologist about it. Absolutely no reason you can't do that. So with that being said, that's sort of the warm up to coffee, caffeine, and recovery. The next video will focus on the scientifically proven benefits of modest consumption of caffeine. And by that, defined to 200 to 400 milligrams per day. And we will look at research from the sports medicine literature. We'll look at research from the cardiology literature. We'll look at meta-analysis that looks at the profound overall benefits in multiple diseases. And I'll put those references in the second video so that you can just see for yourself, judge if I got it right or wrong. And decide for yourself. And certainly, I will guarantee as a minimum, you probably will feel less guilt about drinking that cup of coffee if anyone has said, oh, this is a bad thing to do. Anyways, we'll see you in the next video. Please subscribe to my channel, like my channel. We'll see you on the next time.